This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D-HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
We want you to know that we have a special beam today going to the North Pole. And that's because Santa Claus is taking a break for this hour. He's going to listen because he's got a busy schedule coming up. He's got to be healthy.
He does have to be healthy, and believe me, I can appreciate that.
And as we all have to be healthy, and that's what we're here for, and that's why we call the show Health Watch. Every Sunday we're here, as you know, 8 till 9 on Talk Radio 1210 WPHT. And as you heard the man say, Dr. Molly FANTASIA is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. We're going to do what we usually do in the beginning of the show, the who, what, when, where, why, and how of what Innovative Medical Associates does. We'll also talk about COVID, which I know you're all thrilled about. We'll be talking about that. And whatever you want to talk about, 855-839-1210 is our number here in the studio. If you have a particular medical challenge or you want to just simply ask a question of Dr. Molly, 855-839-1210. That's the number. At any time during the course of the show, feel free to pick up the phone and call 855-839-1210. I know you want to talk about COVID because you've had a very busy week. I mean, a really busy week.
We have, John.
But first, let's get into the nuts and bolts of Innovative Medical.
It sort of goes hand in hand. We are a primary care facility, so obviously we're going to see some of our patients who have COVID. But we can do anything any other primary care facility can do. So if you come in and you have hypertension and you need a pharmaceutical for the hypertension, our docs can write for that pharmaceutical. If you have a cold or something and you need to be tuned up, we can give you something for that as well in the pharmaceutical end. But our philosophy as a whole is we'd like to treat the patient with the least amount of the pharmaceutical that can do the trick. So in other words, we augment the pharmaceutical with natural substances, John, the kind of things we see in health food stores everywhere. And lately we've been seeing them in the new makeover of pharmacies that are now herbal experts and etc., which of course scares Dr. Molly a little bit, but okay. So we're seeing all of that. And you can go in there, and we use many of the products that they have on the shelf, but it's the unique way in which we deliver them, which is through the hydration.
And you deliver it through the hydration because you've often said that's the most effective.
Correct. It's the quickest delivery system, and it's the most effective to effectuate the change and get the patient's quality of life back. And that's what we're all about. So we're not very different from most primary care facilities, but we are. So it's sort of an oxymoron in that we can do anything you can get anywhere else and actually more.
Anything they can do, you can do better.
That's exactly right.
Okay.
So that's technically the overview people understand. And again, I would say that in 9/10 of the cases, when we start to use the hydration with the appropriate vitamins, minerals, amino acids, we can effectuate change fairly quickly. And people actually who are still in the office actually say they start to feel better.
Yeah, I know that. I've seen that myself.
Yeah, it's amazing.
It happened to me myself. But the question is, a lot of times people will come to you and they'll get a couple of drips. And then they'll say, well, you know what? I can go to the health food store and I can get what Dr. Molly's given me. Talk about that.
Okay. First of all, you're never going to get what Dr. Molly and my docs are giving you, my MD-DO physicians. You're not going to get it. Bottom line is you've got to know how to use the appropriate health food store product. And here's the thing. You go there and they have rows and rows of the same products, sort of. Here's the cold aisle. Here's something for your stomach. Here's something for fever. problem is you can get something from a good health food store. I'm not saying that. But in order to get the delivery that we use, we definitely use the hydration. And it makes a tremendous difference, John.
Talk about, and you've often said this, so that people understand, for those who may not have heard this before, talk about the difference between, and you can use your ocean example.
Oh, yeah.
The difference between the hydration and, for
vitamin
example,
C.
I take vitamin C, I take 1,000 a day.
Nothing.
In addition to yours.
Nothing.
Okay.
Drop in the ocean compared to what we can give you.
So you give us the ocean.
That's right. Okay. And you're just getting the drop. So what you're doing is you're keeping the pool filled while you're away from me for a couple of days.
Right.
But ultimately, just like in the pool, you're going to need more water and you're going to need more of the active ingredient.
So the myth that's out there that you can get what you do, you can get it in the health food store.
You can get it at the spa, too.
Right.
There's a lot of things you can get at the spa.
But it's not the same thing.
Not only is it the same thing, the extracts are extremely different. And that I want to warn everybody about, because the FDA is coming down hard on vitamin C. Can you believe this?
Yeah.
They want to know, for example, this past week, I was told by my compounding pharmacist, and by the way, I have contracts with these guys, and they do mix up what we use in our bags, so everything is sterile, etc. And I have many, many combinations. I just was told that the FDA wants to know why I want these particular extracts. I told them why. Because my patients, A, do better on it. B, people tend to have a reaction to some of the vitamin C out there if it's cohorted with something else. And by the way, we get the results utilizing them this way.
And let me explain, for those who may not have heard this, let me explain how you get the extracts. Dr. Molly is a scientist at heart and has 2 PhDs, which I know you would never say, but that's what you have.
Right.
And you developed these protocols
over 20 years.
Over 20-some years, and that's what's in the bag.
Exactly.
So in other words, it's sort of like, and we've often joked about this, it's like Coca-Cola. You don't get the recipe from Coke for how to make it, right?
No, not unless you sign an NDA.
Right. So you don't get the recipe from Dr. Molly because it's proprietary,
right.
And also you developed it over 20-some years of doing this.
And here's the thing. The thing is, in and of itself, you can get all the vitamins you want. What you need to know is how to utilize them together. What is the synergies? What is the energies of certain vitamins with other cofactors, etc.? That's very, very important because it makes the difference whether it effectuates the change or not.
You know, I had a friend of mine the other day. Now, he takes all the supplements.
Yeah.
Takes all, I mean, he showed me his closet.
Well,
I mean,
like that.
Yeah. But he said, you go twice a week, and what are you getting? I said, I'm getting vitamin C and other things. Twice a week? That's a lot.
Well, you know what, John? Here's the thing. For you, I know, you're one of my patients who's a lifer because you had several comorbidities. And as I remember, because I was sitting with you in the hospital, you had one that was pretty darn serious.
Yes, it was.
And so
life-threatening, by the way.
Thanks God it wasn't at that moment, but it could have been. And what I want to say is the smartest thing you do is you maintain what? Your own immune system. Right. And there's nothing wrong with that. It's nothing to be shamed about. It is truly works for people. And I have several lifers, as you know. People have been with me the whole 20 years. Now, some of them don't need to come in twice a week. Some of them come in once a month. Some of them come in once every 6 weeks. But people who have comorbidities know, particularly with COVID right now, know that they want to maintain their own immune system in tip-top shape.
Speaking of COVID, we're coming up on a break, and we're going to be talking about that after the break. It's Health Watch, Sundays, 8 till 9, Talk Radio 1210, WPHT, Dr. Molly Fantasia. She is here. She is the PhD doctor and executive director and founder of Innovative Medical Associates. And I'm your host, John DeMasi. We're going to talk about COVID after the break. And if you have a question about anything, you have a medical challenge, feel free to call in, 855-839-1210, 855-839-1210. Coming back with more of today's Health Watch after these words. And welcome back to Health Watch. Operator standing by right now at Innovative Medical Associates. The number is 856-489-0505. 856-489-0505. Call in, you get some information if you like, and really the most important thing you can do is make an appointment for the initial consultation with Dr. Molly. That is complimentary. And that's really where you can get a lot of your questions answered and information that you need, and then you can make your decision as to whether or not to move forward. It's pretty simple. 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. Before we get back into the show, we were talking about Santa Claus at the beginning of the show. And, well, you want to be Santa Claus. And you know, you probably have several people on your list that you say, gee, what do you get them? They've got everything. So we got a couple of suggestions. Dr. Molly has her latest book, God's Ingredients, TOO, My 30-Year Journey in IV Nutritional Medicine. That's available on Amazon.com or anywhere you get books. So that would be a great gift for somebody because it's kind of appropriate. It could lead them to better health. That's number one. Number two, Dr. Molly has a skincare line, and it's all natural products, and it's developed by Dr. Molly and her good friend, longtime dermatologist, Dr. Harvey Glass. And I've had the products myself. I've had a couple of facials, and they're really terrific. So what you do is you go on the website, innovativemedicalassociates.com, and you check out the skincare line, and you can purchase them right there. And there's another gift for somebody who you probably are saying, what do I get them? What do I get them? So a couple of suggestions. Check it out for yourself. Again, innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio. We said earlier, Dr. Molly, you had a busy week, and COVID took up much of that time.
Yeah, some of my patients had some COVID symptoms. As you know, also, I do some occupational medicine from our clinic, thanks to Dr. Testa, and we're running a COVID testing for employers to test their employees so that we can keep the economy going, you know, same old, same old. So what's happening is that it was interesting because I keep track of how many positive tests we have. Very interesting that we're not having what you would expect as many positive tests as if you listen to all the news. I mean, I'm lucky in that most of these people that we do test are testing negative, and we are using the quick test, the antigen test, which has an over 95% accuracy. And of course, if someone does test positive, we then do the gold standard, which is the PCR test. So I can tell you that that's a little puzzling to me when you hear how bad it is. But interestingly enough, I've had 3 cases of COVID on my own patients in the past 3 weeks. And if you heard last week, I spoke about one of my patients, Tim.
Yes.
Remember that?
Yes.
Well, the good news is he is not only out of the hospital, he is on some room oxygen, an oxygen concentrator. And they said he's going to be on that oxygen concentrator for 3 months. Now, I want people to get this. This is given to a gentleman who is my patient, who does IV therapies, who does the hydration therapies, and was managing to keep his immune system up as much as he could, but he had comorbidities. Unbeknownst to me, and I went back over the history, and I said, hey, Tim, is there anything I'm missing? He goes, oh, yeah, I forgot to tell you. I did work at refineries.
Oh, boy.
Yeah. So he did have some lung involvement. And I will tell you that is a good case of showing how well our protocol worked for him to tune up his own immune system, because I have to tell you, he was a serious case. I sent him to the hospital the minute we did the chest x-ray and saw there was a COVID pattern, even though it was mild at the time. And I think that Dr. Testa and I saved this gentleman's life.
Let me ask you this. Everything I've read, and you've said it here on the show hundreds of times, you have to keep your immune system strong.
Exactly.
And that's why you get the vitamin C treatments, is what I get, and so on
Right.
and so forth.
And there are many other nutraceuticals that will help. Extract, there are many things. Beta-glucan is one. All the anti-inflammatories that we talk about, the grapeseed extract, the turmeric. The list goes on and on. But the point is, you've really got to have someone helping you with this, because I want to see you get through COVID. I also had another patient this week, wonderful gal. We've been treating her with a post-cancer protocol, supportive care. And, she's been very faithful, coming in at least once a week. I will tell you that she definitely tested positive for the antigen. She wasn't feeling quite right. But honestly, she came in every day. We switched up the protocol. And by the way, we isolate the COVID patients. They're not on the grade floor with other people. You know that we're very fussy about making sure that our room scrubber is up to par. I have the whole place decontaminated again today after the week we've had, so that our patients, the rest of our facility, is safe for our patients. In fact, I think in some respects we're safer than many clinics, walk-in clinics. And we follow the COVID rules. So she came through this with flying colors, but her daughter and son-in-law also came in. They weren't patients of the clinic per se, but we've treated them a few times with a few IVs. And I had to send her son-in-law to the hospital. I really leaned on them. They're both chiropractors, so they knew more than me, and
Right.
they do, and
Yeah.
they do.
Yeah.
No, I'm being serious.
Yeah.
But just didn't feel right about the case. She finally took her husband over. The wife took her husband over to the hospital. He went in. He did not have to be admitted. He was having COVID pneumonia, and I think treated traditionally at the ER, and he's going to be back in my chair tomorrow, and I thank God for that. So what I'm saying is there's value to what we do, and I also want to send out a special shout out to Linda, who worked with me side by side the last 13 days, and in particular yesterday.
You mean the lovely Linda?
That's
okay.
it. The lovely Linda. Because I'll tell you, we've been working nonstop to protect our patients in terms of their own immune system, John.
This is probably a question that'll be hard for you to answer, but you've often said this, and I've read it, keeping the immune system up, and that's what you do basically
Right.
at Innovative Medical. But we're hearing about all these cases. Is it because people are ignoring their immune system? Are they not taking care of themselves? Or in the case of Tim, he used to work in a refinery. So is it that kind of thing?
I think comorbidities play a big role in this. And I do believe that, I think, and as one of the things I can tell you, as good stewards of our own health, and that's what we have to be, John. We need to be proactive about our own health, because we can't depend on the medical system to keep us tuned up, as I like to say. We must do that. We're going to talk in the next segment about autoimmune diseases, and I can tell you there are so many of them out there that if you don't maintain your own immune system, you are just waiting for trouble.
So that's the reason to maintain your immune system.
Absolutely. I mean, we can fall victim to anything, right? It's not just COVID. You can have the regular flu. You can walk out. You often say, I'm not getting any colds. Well, I thank God. God has a lot to do with that. But what I am saying is you've become a steward of your own health, and that's important.
You've talked about this, and you've talked about vitamin C, and you've talked about the immune system.
And the anti-inflammatories, all of that.
And that's why you have your cancer protocol.
Exactly. It's a supportive...
The chemo kills the immune system.
Exactly. And I want to get you through whatever road you choose in the cancer journey. I want to help you get through it.
And that's what you do. So in general, if people don't come to see you and they don't get the hydration, what can they do to keep their immune system up?
I would say that they can take a regimen. They can listen to a good nutritionist and try to keep the regimen up. with orals, but I think it's infinitely harder when you have a comorbidity because you can't digest it. Even if you're perfectly healthy, you don't digest all the nutraceuticals you take in orally. So what happens is the direct hit is the best hit.
And that's why you do
why
the
we do
hydration.
the
That's why
hydration.
you always do that.
Exactly.
We are coming up on our halfway point of the show, coming up on a break. And as you heard Dr. Molly say, we're going to talk about autoimmune and whatever you want to talk about. Some open lines here in the studio. And we always tell you that call in early because we don't want you to get shut out. We don't want you to call in at 2 minutes before the show, and then we can't take your call because we have to leave. So call now, 855-839-1210, 855-839-1210. It's Health Watch, Sundays 8 till 9, here on Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor and the executive director and the founder of Innovative Medical Associates. I'm John DeMasi. We're coming back with more of today's Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, and if you would like more information, or most importantly, you say, you know what, my New Year's resolution is to get healthy. What you do is you call them right now and schedule that appointment with Dr. Molly for the initial consultation. 856-489-0505, 856-489-0505. And you can also check out the web, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And our show is Health Watch every Sunday, the live version, 8 till 9, here on Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210, 855-839-1210. I know, Dr. Molly, you wanted to talk about autoimmune, and that's always an issue at Innovative Medical.
Well, you know why, John? Because we're talking about immune health right now in the previous segment. And we have to understand that the immune system is vital to the body's ability to be protected from pathogens and to be protected and to protect the immune system. When the body faces an immune health problem, it can overproduce the antibodies that then send the body, meaning the person, into a overdrive condition. And therefore, that then results in several autoimmune diseases. And there are common autoimmune diseases, and then there are the ones that are not so common. And interestingly enough, there are those of mixed etiology, a little bit of one and a little bit of two, and then they got a big mess. In other words, they may have several subsets of other autoimmune diseases, which makes it very difficult to diagnose for the physician and also difficult to treat because which disease are we treating? So the most wonderful way to do this is to just maintain your own immune system and to keep the inflammation markers in check. So one of the ones that we see commonly is the rheumatoid arthritis. And Sandy, of course, comes to mind. You know that. One of my patients who's been a long-standing patient. And I will tell you, their symptoms are well known. They have swelling in the joints, etc. But did you know that rheumatoid arthritis can affect and harm the skin, the eyes, and the heart? So
I didn't know
not just
that.
the joints.
Yeah, okay.
So there's a reason why people really need to look at possibly hydration therapy for rheumatoid arthritis, because you want to look at the natural anti-inflammatories that can really help the joint pain, etc. So that's one thing, and there's more to rheumatoid.
And we'll get to that in a moment. Let's go to the phones. We have John in Mount Laurel. John, good morning. You're on Health Watch with Dr. Molly.
Hi, John.
Good morning, Dr. Molly. John.
Hey, my favorite John.
Yeah,
Also known as the barber, but he's really a little doctor.
Well,
Okay,
I'm in
John.
desperate need of a haircut, John. Can you bring your scissors in this week?
No. He's too
Very
smart for
expensive.
that. Go ahead,
Very
my friend.
expensive. Listen, I got a question. Of all the people that are coming in and you're picking up different patients with a touch of COVID,
Yeah.
how many of your patients that have, come on a consistent basis, how many of them have come down with COVID in comparison to the ones that don't come normally?
You know what? Less than 1%. You are
Yeah,
so right.
Because I talk to the people in there, and nobody's been that I know has come down with it, and I'm there every week, so I talk to them, and it's an interesting point just to see how much better the immune system is when you are consistent than when you're not consistent.
You know what, John? That is a wonderful point, and I'm glad you brought it up. You know what I see more likely? Most of my patients, and I won't say no, when they bring a family member in, right? We may be treating the husband or the wife, and then all of a sudden the other partner is the one who's sick, and they go, can you treat them too, Dr. Molly? Now, I don't treat. Dr. Testa does the treating. But can I help? Yes. Put them in the chair, and we try to help. But, you know, you are so right. It's less than 1% of our patients who've actually come down with COVID. And I can tell you that, you know, I believe a lot has to do with just exactly what you're saying, which is you've got to maintain your own autoimmune health. And that's it in a nutshell.
Another question on
yes,
that.
Sir. Yes, sir.
Is of the people that come in, how many of the 1% have been inoculated? That's the next question.
Yeah, there are, I have said, listen, you know I'm not an anti-vaxxer, right, John? I'm not an anti-vaxxer. You know?
We'll talk about that another time. But
No, but you're right. I would say I probably 20% or 25% of my patients have done the vaccine. So, yeah. You know, I and then the rest have not. So 75% of my patients are unvaccinated. But it really doesn't skew that number a whole lot. When you look at it, there's a whole lot of people walking around who don't have COVID who didn't get vaccinated in my particular clinic. I have to say it that way, you know.
Right.
But again, I'm not an anti-vaxxer. So, you know,
No,
I want people to do what's right for them.
Right. And you always say that.
Right.
Always.
Yeah, I want people to.
I'll let you go.
God bless
Okay,
you,
John. Thank you for the call. Some good points there.
You know what? I love John because he's a thinking guy, and that's why I call him a little doctor. You know, he's not a pretend doctor. He's just a little doctor, and I like that because he does the research. He's a thinking guy, and that's most of my patients. They think out of the box, John.
Yeah,
they think
absolutely.
out of the box.
All right, let's talk to Shirley in Lindenwold.
Wow.
Shirley, good morning. You're on Health Watch with Dr. Molly.
Hi, Shirley.
Good morning, everyone.
How are
Dr.
you?
Molly, I want to share this. I hope everybody has the radio on because I had just got my Moderna shot, and I ended up in the hospital with a blood clot in my lung.
Oh, my God.
Now, the doctor told me that if I hadn't came there when I did, they wouldn't have been able to pick it up because the machine don't pick up the small blood clots, and he would have sent me home because everything else was fine.
Right.
So now I'm on Eliquis, and now I'm trying to find a vitamin because I've always done vitamin C, turmeric, and all that.
Yes.
And I'm going to have to watch all that stuff. So I'm looking for a multivitamin with no vitamin K.
Yes, I know. It is difficult, but I do believe that Barbara has one. So, you know what we'll do, Shirley? If you call today, Fran's answering the phones today. If you call and leave your phone number, I'll call you back tomorrow after I have a conference with Barbara about some of the multivitamins out there that don't have K, and you can probably pick that up at one of the health food stores near you. I'm sorry to hear you had that problem, my dear. I really am. And, you know, when you get situated, come on over to the clinic and just see us and chat for a little bit because you're a very knowledgeable person. You've called us several times, I know. God bless you, my friend. Thank you.
Okay, Shirley?
Thank
All
you.
right, make sure you make that call, okay?
Yeah, that's a good question. So she took the Moderna and ended up with the blood clots, and that's not unusual. Sometimes these things happen. I will tell you, one of the things that I usually tell the patients who are getting the Moderna shot, I tell them to go on a baby aspirin.
I'm already on that, so
yes,
I'm already taken care of.
I know, but you know what? That's something to tell people because you just, I think sometimes we're so we're so entrenched with giving the vaccine and making sure people don't get the COVID, we forget some of the little nuances to tell the patients, and I think that's important. So getting back to autoimmune, though, John, so we really have to look at what a patient has and how we can help them. So someone like Sandy needs a tremendous amount of the anti-inflammatories. Now, she also did something this week that I really I'm excited about. She got a PRP shot with a lot of, in the mixture of the PRP, which is a form of regenerative medicine, in that mixture had a whole lot of growth factors that were extracted from the cells. So I'm hoping that helps her. Initially, she's going to have some inflammation, have a little pain, and she did. But the question is, I'm hoping that can help her at least firm up the cartilage, etc. there, and give her a little relief in the joints. But also, I want to realize that in a situation like hers, we're worried about more than her joints, because she is definitely an RA patient, has been for some time. And we need to make sure that we then make sure that the rest of her system is in good shape. For example, making sure that her blood pressure, etc., is okay, because we don't want any other problems. And there can be a stiffening around the heart and that kind of thing. So that's one of the things I want to talk about. Lupus. I'm seeing several people with lupus. And again, this is something that it affects the lungs, the nerve, the tissue, the joints, and it has an overall problem. It can actually give them hair loss and some anemia. And the problem with lupus is it can be sort of mixed up with other things like MS, and we see a ton of MS patients. Also Crohn's. I treat a number of Crohn's people come in. Dr. Testa and I work together very closely with that, because I use a subclinical dose of a type of pharmaceutical as well as the hydration. All
right, hold that thought. We'll pick that up after the break. Our final break of the morning, which means you still have time to jump in with a question for Dr. Molly at 855-839-1210. That's 855-839-1210. It's Health Watch, Sundays 8 till 9, the live version here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm John DeMasi. We're coming back with more of today's edition of Health Watch after these words. And we're back here on Health Watch. Don't forget, operators are standing by right now at Innovative Medical, and they will be there well after we leave you at 9 o'clock. Don't think they go home. No. 856-489-0505. 856-489-0505. Dr. Molly doesn't allow them to go home. So
Dr. Molly hasn't been home for 13 days. It's been rough.
Right. It just rough. Continues, right?
It's been rough.
You're looking forward to the holidays, right?
I think I am, John, because, and I'm looking forward to all of my patients having good, great health. That's what's important.
And that, of course, is important. Let me just finish up my little business here. Again, the number 856-489-0505, the website, innovativemedicalassociates.com. And I mentioned earlier that this is the time of year. As a matter of fact, I'm doing this later on today, going Christmas shopping. But if you have someone on your list or several people on your list that you're saying, they got everything, what do I get them? Well, a couple of suggestions. Dr. Molly's book, God's Ingredients, TOO. That's her latest book, My 30-Year Journey in IV Nutritional Medicine, available on Amazon.com or anywhere books are sold. And also Dr. Molly's skincare line. You heard me talk about it earlier. I've had a couple of facials at Innovative Medical, and using those products that Dr. Molly developed with renowned dermatologist Dr. Harvey Glass. And the products are great. It's all natural, as you could expect from Dr. Molly. So you check out the website, innovativemedicalassociates.com, and you'll see the complete line of skincare products. And if you are not sure as to what to get a person, well, maybe you just call at Innovative Medical, and Barbara will get on, or Joanne will get on and tell you which ones they would recommend for you to get. So that's another gift. Listen, you can't get that anywhere else. So check it out, innovativemedicalassociates.com, innovativemedicalassociates.com. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. Couple of minutes left. If you want to jump in with a question for Dr. Molly, 855-839-1210. You were talking autoimmune right before the break.
Right.
Continuing
that. Well, in that vein, type 1 diabetes is another autoimmune disorder that I see. Generally, that strikes kids because what happens is the immune system antibodies attack the insulin-producing cells of the pancreas. There's been a lot of research in that. For many, many years, and they're coming out with many more things than they did prior. So that's a good thing. And what I'd like to say is keeping the blood sugar under control with insulin can help, of course, mitigate the damage. But again, they're coming out with all kinds of new fancy type drugs, etc. Also, psoriasis. There we go. This is a common autoimmune disease that occurs when overactive T cells collect on the skin and then actually create a scaly kind of patches. And it's really a terrible condition because it affects your self-esteem. I have several women who we treat who have this. They're young women. There's hormone-related issues that tend to occur. We're doing very well with that. We actually improved one young woman's skin condition about 50%, and she had this totally. She did not want to go on to the drugs that really close down the immune system, etc. So that's something. Celiac disease, I just got an email for one of my previous patients, one of my old patients that haven't been back in a couple of weeks, and she said, she's having a problem with the celiac condition, and you know what? She's gonna be coming in right after the holidays because gluten-free is trendy, but to avoid the protein, it's found that you really need to look at. So we do this by using the anti-inflammatories. So these are the common autoimmune disorders, and there's a ton of them that are not so common, and they're the ones that are on the rare disease sites, that kind of thing. And I've had my share of people who come in who have the mixed etiology, and that's very difficult even to help them with their quality of life.
I was just going to ask you that you went through a list of the common diseases that compromises your immune system. Other than those diseases, can you think of anything that people may be doing in their daily life that could lead to a compromised immune system?
I would say that we overextend ourselves. We're stressed. We don't eat correctly. And even when we try to eat correctly, we can't get enough of the real nutrition, which is why hydration and the delivery of medical hydration is so important, John. You just can't, what the food we have today compared to what our grandfather and grandmothers had, nowhere near it. First of all, you can eat organic, but even that, you just don't have the nutrition that we had 30 years ago. Soil's different.
You and I grew up in an era where mom and dad cooked every day.
Not only cooked.
You remember that, right?
Not only cooked every day, they shopped every day.
Right, exactly.
They went to a butcher. They went to the fruit stand. They went to the fish store. This is all gone by the wayside. However, you can get a lot of the good vitamins, minerals, amino acids that were in these whole foods, so to speak, by hydration. And that's one of the reasons why I like to extract from natural substances. So,
which is one of the reasons why it's important that people contact you to
exactly
kind of really help themselves.
The extractions are as important as the vitamin themselves, because I love powders, whole food powders that are extracted from food grade. And I believe with all my heart, it is my belief that the body knows the difference between manufactured and whole food extract. And I can't prove it other than in a small group that I have as patients, but I really believe God gives us this innate ability, and I do believe it's something we should really look at and really maintain our health, because it's God-given and we only get one body.
Guess what? We're out of time.
Thanks, John.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates. They'll be there after we leave you at 9 o'clock. They'll be there all day, so you can give them a call, or tomorrow, 856-489-0505, 856-489-0505. Check out the web, innovativemedicalassociates.com, innovativemedicalassociates.com. Don't forget about Dr. Molly's book or the skincare line of products, Perfect Holiday Gifts. Check that out on the web, innovativemedicalassociates.com. And don't forget our replay, our Health Watch replay this afternoon, 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Joanne, fabulous Fran, delightful Dee, and our nurses, Jess, and our newest nurse, Lana. Welcome aboard, Lana. And our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9. Talk Radio 1210 WPHT. Take care.